Hi everyone, welcome back to my YouTube channel, and today we are going to talk about 8 changes in mandible. So let's start our topic with introduction. Mandible or lower jawbone is the largest and strongest bone of the face. It supports the lower teeth, it assists in mastication and speech, and gives shape to lower face. Like all bone, it undergoes significant structure and morphological changes throughout the life due to growth, dental development, and aging. Understanding these changes is essential for dentists, oral surgeons, forensic experts, and orthodontists. Mandible in infancy and childhood. At birth, the mandible is relatively small and its two halves are separated by fibrocartilaginous joint at the midline that are called symphysis menti, which ossifies around the age of 1 to 2 years. The bone appears flat and underdeveloped with a shallow body and wide angle of approximately 140 degree, making the jaw appear small and retruded. The ramesh in the little child or infancy or during childhood is short and condyle is relatively flat and small. The mandible foramen during childhood is positioned near the lower border of mandible because the alveolar bone is not yet developed. During this period, there are no teeth that are present at birth, and the alveolar process begins developing as the primary teeth erupts. Coronary process appear relatively large compared to the ramesh, reflecting the growth demands of early jaw function. Mandible in adolescence and adulthood. During adolescence, mandible undergoes significant growth to match the proportion of face. Mandibular halves are completely fused and the bone becomes stronger and more prominent. The angle of mandible reduced to approximately 110 to 120 degree from the 140 degree in the childhood, giving the jaw a more defined and square appearance. Body of mandible elongates and the ramus becomes taller. Mental foramen shift upward to a position midway between the upper and lower borders of the mandible. Alveolar process during adulthood becomes fully developed to support the permanent teeth, and the condyle becomes broadened, allowing better articulation with the temporal bone. This coronary process becomes less prominent relative to the rest of the jaw. Mandible in old age. In old age, especially when teeth are lost, like edentulation, the alveolar process undergoes significant absorption. They result in marked decrease in vertical height of the mandible, giving the lower face a sunken appearance. Mandibular angle becomes more obtuse again, often measuring around 140 degree, and the chin appears more prominent due to bone resorption around the alveolar region. In old age, the mantle foramen seems closer to the upper border of mandible because of the loss of alveolar bone height. The symphysis menti become more rounded and the bone itself becomes thinner and osteoporotic with reduced vascularity. These changes are natural consequences of aging and are often exaggerated by tooth loss and bone remodeling over time. Clinical importance of age changes in the mandible. Knowledge of mandibular changes with age is essential in various fields. In forensic medicine, the shape of mandible, the position of mental foramen, and mandibular angle help in estimating age from the skeletal remains. In dentistry and prosthodontics, resorption of alveolar process affects denture stability and placement of dental implants. In oral and maxillofacial surgeon must account for bone density changes when planning surgeries, and orthodontists rely on understanding mandibular growth pattern to correct malocclusion in children and adolescents. Conclusion of this lecture video. Mandibles show distinct transformation at different stages of life. In infancy, it is small, flat, and composed of two separate halves. In adulthood, it becomes robust with a well-developed alveolar process and short mandibular angle. In old age, the bone becomes resolved, osteoporotic, and flatter, reflecting tooth loss and age-related remodeling. These changes are not only vital for clinical practice but also serve as a valuable indicator in forensic investigations. And this was all about 8 changes in mandible. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.